Today we are going to look at the paraneoplastic dermatosis. So what does you mean by this? This basically refers to the skin conditions and their malignancies. So to begin with, some questions. So we're going to ask two questions. The first question is in case of the acanthosis. In case of acanthosis nigricans. In case of the acanthosis nigricans, what is this associated malignancy for this condition? The second question is in terms of the erythema. In terms of the erythema gyratum. In terms of the erythema gyratum, and this we are looking at the repens. So erythema gyratum repens. So what is the malignancy associated with this condition? So in this video, we'll be answering these questions and learning in detail about the important conditions. So to begin with, we'll look at firstly the acanthosis. The acanthosis nigricans. So in case of the acanthosis nigricans, this is mostly commonly found in the gastric. In case of the gastric adenocarcinoma. Next, we look at the acanthosis. Acanthosis palmaris. Where is the acanthosis palmaris present? So it is present in the bronchial carcinoma. It is present in case of the bronchial carcinoma. Next, we look at the sign. The sign of the lesser trellet. So what does the sign of the lesser trellet mean? So this is main common associated malignancy is the gastrointestinal AC adenocarcinoma. Then we move on to the acquired ichthyosis. The acquired ichthyosis. So the acquired ichthyosis, it refers to the Hodgkin's disease. The Hodgkin's disease. Now we move ahead, we look at the pityriasis rotunda. So we look at the pityriasis rotunda. So the pityriasis rotunda, it stands for the hepatocellular carcinoma, HCC. Then we move on to the paraneoplastic pigmentation. Paraneoplastic pigmentation. So this paraneoplastic pigmentation is it refers to the small cell bronchial carcinoma. This is the paraneoplastic pigmentation. Then we look at the acrokeratosis. The acrokeratosis. Paraneoplastica. So acrokeratosis paraneoplastica. So this refers to the malignancy of the squamous. This is squamous cell carcinoma, and this is of the upper respiratory as well as the gastrointestinal tracts. Then we move on to the erythema gyratum. The erythema gyratum, and we are looking at the repens. Erythema gyratum and the repens. So this is nothing but it associates the lung cancer. Next, we move on to the other disease, that is the necrolytic migratory erythema. The necrolytic migratory erythema. So in case of this disorder, the conditions it includes is the malignancy, the glucagon secreting pancreatic islet cells adenoma. Next, we move on to the dermatomyositis. The dermatomyositis. So what is this dermatomyositis? It is the lung cancer in the men and breast and gynecological tumors. So gynecological tumors in case of the women. In case of the women and the colorectal cancer. And this is present in both sexes. Both sexes. This is the colorectal cancer. Is present in case of the both sexes. Then we move on to the scleroderma skin lesions. The scleroderma like skin change. The scleroderma like skin change, this is seen in case of the carcinoid syndrome. Then we move on to the paraneoplastic pemphigus. The paraneoplastic pemphigus. So the paraneoplastic pemphigus, the malignancy commonly associated is the paraplastic pemphigus beta cell proliferation. So it's nothing but the beta cell proliferation as well as the thymoma. Beta cell proliferation, thymoma, or the thymoma-like neoplasms. The thymoma-like neoplasms, and specifically it includes the non-Hodgkin's lymphoma. That is nothing but the NHL. Next, we move on to the DH, that is the dermatitis. Dermatitis herpetiformis. So what is this dermatitis herpetiformis? So dermatitis herpetiformis, it is the lymphoma. It is the lymphoma. Now we are looking at the porphyria. Porphyria cutanea tarda, or the variegate porphyrias. So all this goes on to the hepatocellular carcinoma, that is the HCC. Next we move on to the erythroderma. So erythroderma and the exfoliative dermatitis. So this erythroderma or exfoliative dermatitis, the most common thing associated is the mycosis fungoids or the Sézary syndrome. Next, we look at the pyoderma gangrenosum. So what is this pyoderma gangrenosum? It is nothing but a hemat malignancy. It is a hemat malignancy. Then we look at the Sweet syndrome. The Sweet syndrome. Sweet syndrome is nothing but again a hemat malignancy. Then we look at the migratory thrombophlebitis. So what is a migratory thrombophlebitis? So this is nothing but it is associated with the carcinoma of the pancreas. Now we are just jumping on to answering our questions. So the first question we saw was in case of the acanthosis nigricans. Acanthosis nigricans. So here, what does this malignancy commonly associated with? It is nothing but the gastric adenocarcinoma. And the second question we asked was in case of the erythema, gyratum repens. So in such cases, what is the associated malignancy? So the answer is the lung cancer.